Bismillahirrahmanirrahim. Dear student, Assalamu alaikum rahmatullahi barakatuh. Today I would like to discuss about the glucocorticoids. You know already the adrenal gland having two parts, distinctly two parts. One is adrenal medulla, another is adrenal cortex. Adrenal medulla is 20%, adrenal cortex is 80%. Now the adrenal cortex, you know histologically adrenal cortex is three layers. Zona glomerulosa outermost is 15%, middle is zona fasciculata is 75%, and innermost is the zona reticularis. Now histologically is three layers, is zona glomerulosa, zona fasciculata, and zona reticularis. But functionally it is two parts. The outermost, that is zona glomerulosa secretion, is controlled by angiotensinogen 2 and serum concentration of potassium. The inner two layers, that is zona fasciculata and reticular secretion, is controlled by ACTH, that is hypothalamus pituitary axis via ACTH. Now let us start the glucocorticoid. Why it is named glucocorticoids? It named because it will increase the blood glucose level. And glucocorticoid is secreted by zona fasciculata. The main glucocorticoids is the cortisol, and other glucocorticoids are corticosterone, cortisol, and some synthetic glucocorticoids, that is prednisolone, methylprednisolone, and dexamethasone. Prednisolone is 4 times as potent as cortisol. Methylprednisolone is 5 times as potent as cortisol, and dexamethasone is 30 times as potent as cortisol. All of these glucocorticoids have been maximum, it is glucocorticoid function, but they have also a minor mineralocorticoid activity, except the dexamethasone, who is 100% glucocorticoid activities. Now come to the synthesis of cortisol. Cortisol, you know, cortisol is the steroid hormone. Steroid hormone, the raw materials for synthesis of steroid hormone is cholesterol. Either it is direct from cholesterol or de novo synthesis of cholesterol from acetate. 80% of the cholesterol is derived from low density lipoprotein. That is, low density lipoprotein is carried through the blood to the adrenal cortex. Adrenal cortical cells takes up these cholesterol and it goes to the cytoplasm. There is lysozyme, that is cholesterol ester is dissolved to form the cholesterol. That cholesterol again takes up by the mitochondria by cholesterol dysmolase. Then this cholesterol is converted to pregnenolone. Pregnenolone will go in two pathways. One is directly go to formation of aldosterone. Another is, there is, you know, the cholesterol or steroid nuclease name is cyclopentanoparhydrophenol 3. That is, this pregnenolone again combination with hydroxyl ion in 17 position, that is 17 hydroxy pregnenolone. That 17 hydroxypregnenolone is converted to cortisol. Now comes to the metabolism of steroid hormone. All of the steroid hormones is metabolized in the liver. That is, cortisol and other combines with the glucuronic acid and sulfate. Glucuronic acid and sulfate. That is, it is a combination of steroid. Then it is excreted through the bile. And some of the conjugated steroid hormone released in the blood, that is water soluble. Usually the steroid is not water soluble, it is lipid soluble. That water soluble hormone goes through the blood to the kidney and is excreted through the kidney in the urine. Now come to the metabolism, or that is function of glucocorticoids. You know, glucocorticoids having two functions. One is metabolic function, another is non-metabolic function. Now I will like to discuss about the metabolic function. Now the body can prevent stress in presence of glucocorticoid. If minor stress or minor illness may lead to death, therefore glucocorticoid is necessary for the long continued life. But aldosterone is also life-saving hormone. Glucocorticoid also a life-saving hormone. Now, the function of glucocorticoid on carbohydrate metabolism. That is, first it will stimulate the gluconeogenesis and it will decrease the utilization of glucose by cell. Now, what is gluconeogenesis? Gluconeogenesis is a conversion of glucose from non-carbohydrate sources of, that is, glucogenic amino acid and glycerol. Glycerol and glucogenic amino acid is converted to glucose, that is called gluconeogenesis. It occurs in the liver. Now, ask, that is, how it occurs. That is, cortisol increase the enzyme in the liver that required for the gluconeogenesis. Again, cortisol mobilize amino acid, especially from the skeletal muscle and lymphoid tissue. That amino acid form the glucose, that is called glucogenesis, and stored these glucose is stored in the liver as glycogen. Also, in between meal, the glucocorticoid maintain the blood sugar level. How does it maintain? Suppose when there is a excess of glucose stored in the liver, that is glycogen, glucocorticoid or cortisol activate the glycolytic hormones. What are the glycolytic hormones? One is glucagon, another is epinephrine. It is activated by cortisol. That hormone convert glycogen to glucose, and this glucose then supply to the blood, and blood glucose level will be maintained. Now come to the decreased utilization of glucose by cell. Now, before going to this discussion, how the glycolytic, that is cortisol, acts. That is cortisol, you know, the NADH, that is reduced form of NAD, is converted to oxidized form. That oxidized form of NAD is responsible for the glycolysis. Now, cortisol inhibit the conversion of reduced NAD to oxidized NAD, and there is glycolysis is inhibited and blood sugar level is increased. Now, reduce glucose utilization by this cell. Now, these all combination increase the blood glucose level. Now, when the cortisol, it causes increased blood glucose concentration, and that lead to adrenal diabetes. Why there is adrenal diabetes? You know, the gluconeogenesis and also decreased rate of glucose utilization by the cell all increase the blood sugar level. Although the insulin level in the plasma is high, but corticosteroid or cortisol reduce the sensitivity of some tissue to the effect of insulin. As a result, some tissue cannot take up the glucose, that is adipose tissue as well as skeletal muscle. Another way, that is cortisol also increase mobilization of fat, that is increased fatty acid, that also reduce the sensitivity of this tissue, that tissue to insulin action. These all result to increase blood sugar level. That is, what is the difference between adrenal diabetes and pancreatic diabetes? Adrenal diabetes, 100, that is, suppose the blood glucose level is 100 milligram per deciliter. In adrenal diabetes, it may increase 50%, that is 150 milligram per deciliter. If you treated the adrenal diabetes with insulin, that blood glucose level will not reduce to normal level. Pancreatic diabetic, if you use or administer the insulin, the glucose level will become to normal. That is, adrenal diabetes is resistant, glucose, insulin resistant diabetes, and adrenal diabetes in the insulin resistance diabetes. Now come to the cortisol acts on the protein metabolism. Protein metabolism, that is cortisol, decrease the formation of protein and increase catabolism of protein. That is, cortisol increase mobilization of amino acid from extrahepatic tissue, usually from skeletal muscle, and cortisol inhibit the messenger RNA that prevent the formation of protein, especially in the skeletal muscle and the lymphoid tissue. If excess of cortisol, the skeletal muscle become so weak the person cannot stand up from squatting position, and also it will prevent the protein formation in the lymphoid tissue. And cortisol increase the liver protein synthesis and the plasma protein synthesis. And cortisol also in the liver, it causes increased deamination of amino acid, increased protein synthesis, and increased plasma protein synthesis, and increased conversion of glucose from amino acid. Now come to the fat metabolism. The cortisol increased mobilization of fat from fat adipose tissue, that is increased plasma concentration of the fatty acid that will provide energy, and it is utilized by the cell. And as you know, the adipose tissue is consist of triglyceride, that is 3 fatty acid, 1 glycerol. The glycerol portion is derived from glucose, and therefore cortisol inhibit the sensitivity or of glucose uptake by adipose tissue. Therefore, there is no formation of triglyceride, and triglyceride is not deposited, and excess release of fatty acid from the adipose tissue. Excess of cortisol increase mobilization of fat from peripheral tissue, and it will deposited to upper abdomen, chest, around the neck and moon. That is called moon face and buffalo torso. Now come to the regulation of secretion of cortisol. Cortisol is secreted. If you see this picture, you can understand how the cortisol secretion will be regulated. You see cortisol. Cortisol, it is an anti-stress hormone. Now you are facing so much stress. That is a mental stress as well as physical stress. Now you are facing the mental stress. Mental stress. When there is a mental stress, now so many students, they are facing mental stress. One is coronaphobia, another is they cannot go outside, always confident in the room that they are facing stress, and some foreigners, they are facing stress for political purpose. That stress excites the hypothalamus, and hypothalamus will release the corticotropin releasing factor, and it comes through the axon of the neuron, then it comes to the median eminence. From the median eminence, it is absorbed in the hypophyseal, hypothalamo-hypophyseal portal vessels. Then it goes to the anterior pituitary. That these corticotropin releasing hormones stimulate the corticotropes in the anterior pituitary. It releases the ACTH. That ACTH will stimulate the adrenal cortex to release cortisol. And cortisol's function is the gluconeogenesis, protein mobilization, fat mobilization, and stabilization of lysosomal enzyme. That will relieve the stress. In another way, cortisol negative feedback mechanism, it inhibits the anterior pituitary to inhibit the secretion of ACTH, and it directly to hypothalamus to inhibit the secretion of ACTH. That is memory stabilization of lysosomal membrane. Now come to the diurnal variation of cortisol mechanism. You know, early in the morning, before getting up from the body, methylglutarium. That is the diurnal variation of cortisol secretion. You see the maximum cortisol secretion is just before getting up from morning. It is at 8 a.m. and minimum is 12 midnight. That is at 12 a.m. the concentration of cortisol is 20 microgram per 100 milliliter. Again, in this is a 5 microgram per 100 milliliter. Now, why there is this secretion of increase in the early in the morning? This stress is not to getting up from your bed, but is this stress, I think, some signal going to the hypothalamus, and hypothalamus release the corticotropic releasing hormone that is responsible for increased secretion of cortisol early in the morning. Sometime ask during your in ward, sometime you have to give the requisition cortisol concentration. That time you have to collect blood at 8 a.m. Then you may get the concentration of cortisol is maximum. I think this is today I want to conclude my lecture. Next class I will discuss about the non-metabolic function of glucocorticoids and other diseases. Thank you.